Okay, let's dive into the sources you've sent. We're looking at something pretty serious today, ventricular fibrillation in dogs and cats. It's definitely something no pet owner ever wants to face.
No, absolutely not. And for good reason. VF, as it's called, is really the most life-threatening rhythm problem the heart can have. It's essentially cardiac arrest defined by electrical chaos.
Right. The heart just stops working properly, instantly critical. So,
Right.
using these sources, we want to figure out, what is VF exactly? Why does it happen? What does it actually look like? And importantly, what can be done? Let's get into it. So, maybe start with the basics. How does a normal heartbeat work? And then how does VF just break that?
Sure. A healthy heart, well, it's got this incredibly organized electrical pathway. Think of it like a spark starting up top in the SA node, the natural pacemaker.
Okay.
That spark travels through the top chambers, pauses for a split second at the AV node like a checkpoint, and then it goes down these special fibers, the Purkinje fibers, into the ventricles, the main pumping chambers.
And that makes them squeeze together.
Exactly. A coordinated, powerful squeeze pushes blood where it needs to go.
Mm.
Very efficient.
Okay, so that's normal. What's VF then?
VF is, well, it's the opposite of organized. Instead of that one spark leading the way, you suddenly get hundreds of tiny, chaotic electrical impulses firing off randomly all over the ventricles. It's just electrical anarchy.
Anarchy. So I guess that means no coordinated squeeze. The pump is broken.
Completely broken. The ventricles don't actually contract. They just sort of quiver or twitch. There's no effective push, no force behind it.
And the result of that is?
Zero cardiac output.
Hmm.
Nothing's being pumped out. Blood flow just stops. That's circulatory collapse right there.
Wow, okay. And the sources show these ECG tracings. They look pretty wild. What does that electrical chaos actually look like on an ECG strip?
Yeah, it's unmistakable once you've seen it. You
Yeah.
know the normal ECG, the little P wave, the big QRS spike, the T wave bump.
Right.
Forget all that. With VF, you just see this rapid, irregular, completely chaotic line. The waves, or squiggles really, are all different sizes, different shapes. No P waves, no QRS, no T waves, nothing identifiable.
Just noise, basically.
Pretty much. Sometimes they call it coarse VF if the waves are bigger, or fine VF if they're really small, almost flatlining, which usually means things are even worse electrically.
It paints a stark picture. But, what really jumped out from the sources was the list of causes. It's not just animals with pre-existing heart conditions, is it?
That's such a crucial point. VF is often the final pathway, the terminal event. It can happen when severe heart disease finally progresses to that point, yes, but it can also be triggered by a whole range of severe acute crises happening elsewhere in the body.
Let's unpack those. What about the primary heart diseases mentioned?
Okay, so cardiomyopathies are definitely high on the list.
Okay.
Things like dilated cardiomyopathy or DCM, you see that in big dogs like Dobermans, Great Danes, Boxers. Their heart muscle gets thin and weak.
Makes it unstable.
Exactly. Electrically unstable. Then there's hypertrophic cardiomyopathy, HCM, mainly in cats, where the heart walls get too thick and stiff. That also messes with the electrical flow.
And boxers have another one mentioned.
Yes, ARVC, arrhythmogenic
Right.
ventricular cardiomyopathy, fatty tissue gets into the muscle. And some German Shepherds have an inherited electrical problem, IVA. All these structural changes make the heart prone to chaotic rhythms. The sources also list things like myocarditis, that's inflammation of the heart muscle itself. Less commonly, maybe actual heart attacks like ischemic disease, severe leaky valves sometimes, or even certain birth defects in the heart.
So definitely heart problems, but then there's this whole other category, the acute systemic stuff. That list was surprisingly long.
It really is, and it shows how connected everything is. Severe electrolyte imbalances are a huge one. Electrolytes like potassium, calcium, magnesium, they're critical for nerve and muscle function, including the heart's electricity.
High potassium.
Yeah, hyperkalemia, high potassium is a classic trigger. See it with blocked male cats, for instance, or severe kidney failure, Addison's disease. It dramatically destabilizes the heart rhythm. But low potassium, low magnesium, even high calcium can contribute.
Okay, what else besides electrolytes?
Lack of oxygen. Severe hypoxia or anoxia. If the body isn't getting enough oxygen from, say, severe pneumonia, drowning, choking, even severe anemia or carbon monoxide, the heart muscle suffers and can go into VF.
Makes sense.
Then you've got severe disturbances in the body's acid-base balance, major trauma or shock, certain toxins or drug overdoses, even some anesthetic agents or heart medications given at toxic levels.
And GDV, bloat in dogs.
Absolutely. GDV is notorious for causing severe arrhythmias, including VF. It's linked to the shock state and maybe the physical pressure in the abdomen. Also, severe widespread infection or inflammation, sepsis or SIRS, electric shock. even getting severely cold, hypothermia.
It's just
Yeah.
so many different things can lead to the same catastrophic electrical failure in the heart. So if VF means the heart has effectively stopped, what does that actually look like to someone witnessing it? What are the clinical signs?
Well, like the sources say, it's sudden, it's dramatic, there's usually no warning, just collapse.
Instant collapse.
Pretty much.
Yeah.
The animal becomes unconscious immediately. Unresponsive, you won't be able to feel a pulse like checking the artery inside the back leg.
No heartbeat sounds either.
No, if you listen to the chest, you won't hear anything. And breathing stops. Apnea, they just stop breathing.
Anything else? The eyes.
Yes, good point. Because the brain isn't getting oxygen, the pupils usually dilate very quickly, become wide open. You might also see the gums or tongue turn bluish, that's cyanosis, but that might take a moment to become obvious.
Okay, so collapse. No pulse, not breathing. That's the red alert. In a clinic, how is it formally diagnosed?
It's diagnosed incredibly quickly based on those signs. You see that combination, you know it's cardiac arrest. The definitive confirmation, though, comes from the ECG.
And the ECG shows that chaotic pattern we talked about.
Exactly. It shows that rapid, irregular, disorganized electrical activity. No recognizable P waves, QRS complexes, or T waves. Just that chaotic squiggle. Of course, you quickly make sure it's not just like a loose ECG lead-causing artifact that looks similar, but true VF is pretty distinct on the trace.
Right. Okay, we know what it is, why it happens, what it looks like, how it's confirmed. Now, the really tough part, treatment. What can actually be done? The sources seem pretty clear there aren't many options.
Yeah, they're very direct.
Yeah.
This is an absolute code red emergency. Immediate, aggressive treatment is the only chance. And the sources all agree the only truly effective treatment is prompt electrical defibrillation. That shock, combined with good CPR,
Without shock.
without defibrillation, the chances of survival are practically zero. It's that critical.
So CPR first, while getting the defibrillator ready.
Yes. CPR starts immediately. Basic life support, or BLS. That means chest compressions hard and fast. The goal is 100 to 120 compressions a minute, pushing down about a third to half the chest depth, and giving breaths. Usually it's 30 compressions, then 2 breaths. Unless they're intubated, then you can often do breaths more continuously.
Trying to keep some blood moving.
Exactly, trying to perfuse the brain and heart just enough. Then there's advanced life support, ALS. That involves hooking up the ECG, getting an IV line in for drugs, and ideally using capnography to monitor the CO2 in their breath, which tells you how effective your compressions are.
Okay, and then the defibrillation itself. How does the shock, how does it work?
So the defibrillator delivers a controlled, high-energy electrical current across the chest through the heart. The goal is to shock all the heart muscle cells at once, depolarize them simultaneously.
Like a system reset.
Precisely. You're trying to stop the chaos, silence all that random electrical noise, and give the heart's natural pacemaker, the SA node, a chance to take back control and start a normal, organized rhythm again.
How's it done? Pedals on the chest?
Usually, yes. External defibrillation with paddles, sometimes internal paddles directly on the heart if they're doing open chest CPR. And there are different types. Biphasic are generally better than the older monophasic ones.
And the process? Just shock and see.
Not quite. The standard now, based on recover guidelines, which these sources likely reference, is you deliver one shock. Then, crucially, you immediately resume CPR for 2 full minutes without checking the rhythm.
2 minutes of CPR right after the shock.
Yes. That immediate CPR helps circulate blood and gives the heart muscle the best chance to respond if the shock worked. Only after those 2 minutes do you pause briefly to look at the ECG again. If VF is still there, you might give another shock, possibly at a higher energy setting, and repeat the cycle.
I think the sources mentioned a precordial thump.
Yes. Basically a sharp blow to the chest over the heart. It's sometimes mentioned as a last resort if you have absolutely nothing else, no defibrillator. The idea is the mechanical thump might generate a tiny electrical charge. But the sources are right. It's very rarely successful. It's not a substitute for defibrillation.
What about medications? Are drugs used during this?
Yes, drugs play a role, but they're considered adjunctive. They support CPR and defibrillation. They don't replace them. Antiarrhythmic drugs like lidocaine or amiodarone might be given, especially if the VF is resistant to shocks or to try and stop it coming back if you do get a normal rhythm.
And other drugs.
Vasopressors are key during CPR itself. Drugs like epinephrine or sometimes vasopressin. They help constrict blood vessels to try and increase blood pressure and push what little blood is moving towards the heart and brain. They're given intravenously every few minutes during the CPR cycles.
Are there downsides to the drugs?
Well, potentially. The sources might note that lidocaine, while trying to prevent VF, could theoretically make it slightly harder to defibrillate out of VF. Amiodarone can cause low blood pressure. It's always a balance in a crisis. And there's mention sometimes of chemical conversion, injecting things directly into the heart if there's no defibrillator. But again, that's really a desperation move with very low success rates.
Okay, it's a massive, coordinated effort against the clock. But even with everything done perfectly, let's talk prognosis. The sources were pretty grim.
Yeah, there's no way to sugarcoat it. The prognosis for VF is, well, it's dismal. Extremely poor. Survival rates for animals arrested in the hospital are already low, generally quoted as less than 10%. And for VF specifically, it might be even lower.
Less than 10%.
Sadly, yes. The vast majority of patients experiencing VF do not survive, even with optimal treatment.
So for that tiny fraction who might pull through, what makes the difference? What factors give them that slim chance?
Time is absolutely number one. The time from collapse to starting good CPR, and especially the time to that first defibrillation shock. Every minute, every second counts. Faster intervention equals a better chance, however small.
Makes sense. What else?
Being able to identify and potentially reverse the underlying cause helps. If it was triggered by, say, severe hyperkalemia that you can rapidly correct, the outlook might be slightly less hopeless than if it's end-stage heart failure where the heart muscle itself is just done.
The severity of the underlying problem matters.
Hugely. And the quality of the CPR provided is also critical. Effective compressions, good ventilation, they keep minimal oxygen flowing while you're trying to fix the rhythm. Honestly, given how poor the outcome is once VF happens, the focus really shifts towards prevention and avoidance whenever possible. Identifying heart disease early through checkups, listening to the heart, maybe doing echocardiograms if needed, and managing it properly with medication.
And for those other triggers.
For critically ill patients, it's about intensive monitoring. Watching electrolytes, oxygen levels, acid-base status closely, trying to catch and correct problems before they push the heart over the edge into VF.
Right. This has been, well, a very sobering deep dive, but really important for understanding what the sources say about this condition.
It really drives home that VF is this final common pathway for so many severe problems, heart-related and otherwise. And it underscores the absolute urgency, the need for defibrillation, but also the harsh reality of the prognosis.
Absolutely. So to recap, VF is that chaotic electrical storm in the heart causing cardiac arrest. It has a huge range of causes, from primary heart disease to all sorts of systemic issues. The signs are sudden collapse, no pulse, no breathing. Treatment demands immediate CPR and, crucially, electrical defibrillation. But even then, as the sources stress, survival is tragically rare. Thanks for walking us through all that.
You're welcome. It's vital information.
And maybe a final thought for you to consider. Based on everything we've discussed, given that VF can arise from both slowly developing chronic heart disease and sudden acute systemic crises, how does that duality challenge our approach to both routine preventative care versus readiness for unexpected critical emergencies in our pets? Something to think about.